Hello, my name is Dr. Robert Bartosh of Proactive Wellness here in Danville, Illinois, and I'd like to first congratulate you on the obvious interest you have in your health, which is demonstrated by the fact that you're viewing this presentation. And I'd also like to thank you for the opportunity to do so, because we're going to be talking, or I'm going to be talking about a very misunderstood topic, and that is in regards to balancing women's hormones naturally. And it's basically a holistic or an alternative or a natural approach, if you will, to women's hormone and related health concerns. So without any further ado, we'll go ahead and begin. You know, hormones affect women at different stages in life. All women are going to be affected by this. And every woman, I should say, will eventually have a change in hormonal balance from the time that she enters puberty throughout menopause and beyond. And up until now, the common or most used solution for most women's hormones problems has been hormone replacement therapy, HRT. I'm sure you're familiar with this. However, what you may not be familiar with is that there was a study that was conducted by the Women's Health Initiative, the WHI, and it showed physicians and led them to revise their recommendations regarding the use of hormone replacement therapy. Now, this investigation was started way back in 1993, had over 161,000 women in it that were aged 50 to 79 years old. And it was conducted throughout 40 different medical centers here in the United States. Now, part of the study was intended to examine the health benefits, and also it was to study the addition of the risks of hormone replacement therapy, including the risk of developing breast cancer if you are on hormone replacement therapy, the risk of having a heart attack if you are on hormone replacement therapy, or developing or having a stroke, and blood clots as well. Now, in July of 2002, this study was actually stopped early because the health risks exceeded or were greater than the health benefits of being on hormone replacement therapy. As a matter of fact, the main reason for stopping the estrogen progestin study was because of a documented 26% increase in breast cancer. What they said was that 26% of the women that were on hormone replacement therapy in this study actually started to develop breast cancer or had the breast cancer. And moreover, in March of 2004, the Women's Health Initiative estrogen-only study was also stopped early. And this was because there was a noted increase in the risk of strokes in the women that were in the study. Now, among the women taking the estrogen progestin, the number of heart attacks actually increased by 29%. In addition, the WHI study also showed, and this is amazing, a 41% increase in strokes. So they were showing that these women that were in this study were having heart attacks, were developing breast cancer, were getting strokes, all as a result of the HRT. And this same study also confirmed an increase in the number of blood clots in women taking the estrogen progestin. And for every 10,000 women taking the HRT, 34 they prognosticated would develop blood clots in their lungs or their legs. So the researchers at the University of Texas Anderson Cancer Center also announced recently that the incidence, this is really quite interesting, the incidence of breast cancer in the U.S. dropped more than 7%. Now, the reason for the drop was this. It came just after millions of women started avoiding the hormone replacement therapy following the publication of the results of the Women's Health Initiative study in 2002. So what they're saying is, when these women became aware of what was happening to women on the HRT throughout the studies, the heart attacks, the breast cancer, the clotting, and whatnot, the strokes, many women discontinued the HRT, and as a result, the amount of breast cancer, the number of breast cancers in the United States actually dropped by 7%. As interesting as that may be, this is even more interesting, I think, because despite all the side effects that we just went over, a recent survey showed that 38% of the women in the United States who are between the ages of 50 and 74 still insist on using hormone replacement therapy as the answer or the cure, if you will, for the hot flashes, for the PMS, for whatever it is they're going through, despite all of the adverse effects that the other women were experiencing. And if that's not enough, here's another example of how women are given solutions that may actually cause even worse problems. Hysterectomies. Now, believe it or not, hysterectomies are often recommended to solve numerous patient complaints. You know, if it's bothering you, then what we're going to recommend is to have the organs removed. Now, according to the book Under the Influence of Modern Medicine, they stated that 40 to 80, that means 4 to 8 out of 10 of all hysterectomies are absolutely, totally unnecessary. And when an individual has a hysterectomy, this surgery that 8 or 4 out of 8 times out of 10 is unnecessary. Once they've had these organs removed, they must be on a lifetime of hormone replacement drugs for the rest of their life. Now, see, let's think about this for a moment. Now they've got to go on drugs that will increase their potential of having heart attacks, breast cancer, strokes, blood clots. The list goes on. And that's what they are. That's what their future holds now that they have undergone this surgery. Now, the purpose of this talk is twofold, and I want to make it very clear to you. Number one, I want to provide the true facts about hormone-related problems. Now, this is not anecdotal. This is not what Mary said or what Susie heard or what was read in a tabloid or in a magazine or even on the internet. I want to provide you with facts. And with these facts, I want to help you then to make an informed decision, not an emotional one, on the various natural solutions for PMS and menopause. That's my purpose here, or those are my purposes, I should say. So what I want to do here is pretend that we're going to look at a health survey. And I want to ask you, do you have any of these symptoms? Do you have any headaches or hot flashes? Do you experience fatigue or mood swings or have trouble sleeping or whatever it might be? Because this is the question then. Do you have more than one symptom? Do you have more than one of these symptoms that I just spoke about or some that I didn't mention? If you do, I want to tell you what it means. If you have more than one symptom, or the one symptom you have occurs more than once a week, then honestly, you have a situation that you really need to be concerned about. You see, it's never, and never is an absolute term, it's never normal to have a symptom. A symptom is actually your body's way of letting you know that you have something going on within you that's not right, and that something needs to be checked. Because if it's not, that something will continually worsen, and the results of which might be very, very damaging to your health. Now, would you check your car if the engine light went on? Now see, and that might be a ludicrous or a foolish question, because absolutely, yes, I'm sure I would. I mean, that car is expensive, you know. Good grief. Well, you see, symptoms are a warning that something is wrong, in the same way in your body. Now, there's no such thing, as I said before, as a normal symptom. It's not normal, despite the fact that you're told, well, it's normal to have a headache before, it's normal to have hot flashes, it's normal to have discomfort, it's normal to be sick. When it's normal, it's never normal. Symptoms are not normal. You know, we go back to your car, and again, you would check your car to make sure that it didn't get worse. I mean, you know, that's as I said, it's an expensive investment. Well, you know, your body is the only one that you're ever going to get while you're on this earth. And once you lose it, you lose it. Once you lose your health many times, you can't regain it, not to the point that it was previously. And, you know, seriously, your body deserves, honestly, the same attention. So today, you're going to have two choices regarding your health. As I share this information with you, you can either do the same things that you're doing right now, and I promise you, you're going to get the same results. Or you can try something new, something different, and I promise you, if you do that, you're going to get a different result. The choice is always yours. Look, when it comes to your health, you don't want to make an emotional decision. You want to make an informed decision. And in our office, it's always, we tell our patients, it's your body, it's your health. It's going to be your choice. Don't ever allow someone else to make a decision for you. Don't ever allow the doctor to compel you or to force you or to feel that you're obligated to do what he or she is recommending. Always have reasons for what you're doing, and make sure that they're good reasons indeed, especially when it comes to your health. So if I could show you today how to get rid of your problems by doing something natural, something different, something affordable, would you do it? I'm going to ask you. This is ludicrous. I know this is silly, but raise your hand if you would. Now, the reason I'm doing that is research shows us that the more we incorporate or commit in decision-making, the more we utilize our bodies in doing this, the more apt we are at following through. So even though I can't see you do it, you know, raise your hand if you would. That way, you know, hopefully you're going to act upon the information that I'm about to share with you. Now, the symptoms that you have, whether they're labeled PMS or osteoporosis or menopause or perimenopause, it doesn't matter what they're called, they all have a cause. They have a reason for being. And the true cause of the symptoms, now the true cause, that's a very important point, of the symptoms, it's going to tell us the most effective treatment. It's been said that if we know the cause, the cure is going to present itself. And that is so very, very true. But the point here is that we need to identify the true cause in order to resolve the effect. Now, the cause may be any one of the following. Now, please believe me, it could be your symptoms, the PMS, the menopause, whatever. It could be caused by a deficiency of the hormone estrogen. It could be a deficiency of the hormone progesterone, or it could be both. Or it couldn't be either. It could be caused by having low blood sugar. Believe it or not, you may not have a hormonal problem, but rather a low blood sugar problem that's resulting in a hormonal problem. It could be stress on the adrenal glands. It could be a lack of certain vitamins and minerals. And finally, and actually, it could be a malfunctioning nervous system. So first, what we're going to do is look at the estrogen-progesterone balance, the balance between these two hormones. Now, many women have what's been called estrogen dominance, and this is when their body has excess estrogen, and it's unopposed by the progesterone. Those two hormones, they have to have a balance. It could be that you have too much estrogen because the body's producing too much estrogen, or it could be due to the fact that it's producing enough estrogen but not enough progesterone. Therefore, it seems that there is an imbalance. It could be that as well. Now, according to Dr. John Lee, MD, the symptoms of estrogen dominance are virtually identical to those of PMS and menopause. They're identical. So you see, we have to go ahead and we have to separate and identify which is which and what the cause is of each of those. As well, these things could be and are a causative factor in fibrocystic breast diseases, in endometriosis, and in polycystic ovary disease. So it could be estrogen dominance, it could be PMS, it could be menopause. We don't know. We have to identify. But in any event, all of those are causative factors in the fibrocystic breast diseases, endometriosis, and the polycystic ovary disease. Now, this estrogen imbalance, believe this or not, can be improved. this is where we start. It could be improved by eliminating estrogen-containing foods, and many people don't realize this, such as commercially grown chicken, poultry, and meats, as well as the dairy products such as milk and cheese. You see, these animals are given these hormones in order to increase their size, in order to increase their production of the milk or whatever it might be. And then what happens is you and I sit down and we ingest these meats in which are these hormones, and now you have these hormones that came from these meats and foods inside your body, and there is an excess. Now you have not only the hormones that your body has been producing, but also now the hormones that you have been ingesting. So therefore, in time, it creates this imbalance. Now, one thing that would benefit you in general would be by switching to range-free chicken, organic meats, organic whole milk, to avoid consuming the hormones that have been added to the beef and the poultry. Now, this is a lot easier, believe it or not, than you might realize. Many grocery stores, many markets now are carrying range-free chicken. They're even on the labels you can buy these. And then the grass-fed beef, or finding a local farmer and co-oping with other individuals and buying grass-fed beef from farmers who aren't feeding or injecting their cattle or their poultry with these hormones. And then also the organic whole milk if you so choose dairy. But you can absolutely positively make this switch, and it's going to have a positive effect in your overall well-being. A natural solution that's been recommended by Dr. Lee actually would require the use of what he deems as a safe, non-carcinogenic, that means it doesn't produce cancer, and it's a plant-based form of progesterone. And this is used as a lotion on the skin, or it's taken under the tongue in liquid form. And as I said, it's a plant-based progesterone, not an animal progesterone, and it may help to restore the hormone balance. Now, I frankly have to tell you that this is not something, as a clinician, that I recommend to our patients that are coming in, because of the avenue of ingesting the hormone into the body, in the skin, and or under the tongue, whatever it might be. That is unnatural. It bypasses the normal pathways that are used by the body, and I frankly don't feel comfortable in doing that. However, this is a discussion, should you so choose this approach, to discuss with your doctor. And, ask the questions to he or she so that you you're satisfied with the approach. Now, also, if you do go this route, make certain that the cream that you're using has USP on the label, because the USP signifies that the hormone that you're about to apply or ingest is a certified pharmaceutical grade, and it's of the highest quality. Look, folks, you've got to be careful too, even when you go to the health food stores or you buy it, even if you buy it off the internet. As a matter of fact, there was a report that was processed by the FDA and the FTC not too long ago, and it stated that over 98%, this is unbelievable, over 98% of the so-called supplements and the nutrients that were purchased over the internet outside of a doctor's office were actually bogus. I call them garbage. Now look, when it comes to making an effect on your health and a financial investment in doing so, my recommendation is to really scrutinize the sources and make certain that you know what you're getting and what you're putting into your body. Now, the next potential cause to the hormonal imbalance might be low blood sugar. Believe it or not, it could be low blood sugar. We eat poorly today in the United States, and it's kind of being transferred throughout the world. But regardless, women who suffer from low blood sugar can actually be misdiagnosed as having hormone problems, because the blood sugar levels, they can directly affect your mood, and they may affect your vitamin and mineral levels, And so as such, it has to be a problem that has to be ruled out. You know, most of the foods that many people eat are sugar laden. They are packaged foods, or they are processed foods. They are basically inert as far as their energy producing factors, and this causes an adverse reaction in the body where you're having low blood sugar, which is going to affect the mood, and the vitamin and mineral levels, which are depleted at best. And as such, you have to rule this out, because it may not be a true hormonal problem, but the cause may not be that imbalance, but rather the fact that the individual has low blood sugar. So this is something now, you know, if you recognize yourself in this, if you're craving sweets, if you depend upon coffee, if you drink a lot of coffee, or you become drowsy in the middle of the day, then you may be an individual who has low blood sugar. And again, as such, you need to rule this out. You need to get it checked with your treating physician. You need to find out before you quickly, the recommendation is made that, well, you know, Ms. Jones, you need to get on hormone replacement therapy, because that may not be the solution at all. Because if you still have low blood sugar, and even though you're on the hormone replacement therapy, I assure you, you're not going to get better. You're actually going to get much, much worse, and very, very quickly. Now, another factor that can affect these issues involves hormones that are released by the stress glands. Now, these stress glands are called the adrenal glands, and I'm sure you're well aware of adrenal glands. When a person experiences an upsetting or challenging situation, and who doesn't have an upsetting or challenging situation even daily? Well, what happens is the adrenal glands begin to secrete hormones that cause the body to prepare either to fight or to run. This is called the flight or fight reaction. Remember? Yeah, you learned about this in school. Now, because of constant upsets or challenges, these glands can lose their ability to function properly. Because of constant and upsets and or challenges, these glands get weaker and weaker and weaker. Now look, you drive down the road, somebody puts on a right turn signal to turn left in front of you, somebody passes you quickly only to get in front of you and slow down. You know, people, you're standing in line and they get your order wrong. You get a call from your bank and there's an error in your account, or your kid, you get a call from school and your child has been reprimanded, whatever it might be. But the point is, we live in a stress-laden society. Over and over, we're challenged, or numerous times we have upsets throughout our day, and from day in and day out. And as a result, these adrenal glands, which were only designed to fire and then quickly shut off and do so randomly with a long time period in between, are now on and off, on and off, on and off throughout the day. And as a result, we are needing more caffeine and more sugar to keep us going, because we're drowsy, we're fatiguing, our bowels don't move without the caffeine, or whatever it might be. And as a result of that, these types of foods further exhaust and weaken the adrenal glands. And because these glands now secrete several different hormones that are directly related to many women's hormones problems, the stress and the adrenal weakness has to be considered. It has to be considered as a part of the overall solution or a potential cause of the problem. So that's got to be addressed. It's got to be ruled out. Now, one of these adrenal hormones is called DHEA, dehydroepiandrosterone, and I had to say that because it's a 35-cent word, and it makes me sound even, well, it makes me feel better when I say it. So anyway, this steroidal hormone has been familiar to scientists for many years, but, you know, the reason for its being was really unknown. But researchers have known now that DHEA acted to produce a reservoir or a surplus of estrogen in the body. In fact, as a woman ages, the adrenal hormones now take over and they become a secondary source of estrogen. See, they start to produce the estrogen that's needed by the women. However, if the adrenal glands have been exhausted and they're weakened, they can't produce the amount of hormones that's necessary. You see how it works? So the DHEA has now been found to also, it helps in osteoporosis, it helps in cancer situations, it helps arthritis, diabetes, chronic fatigue syndrome. So if your hormone problems are due to an adrenal gland weakness, you can see that other health problems may also result. See, it's not just about the hormones, and it's rarely do we find a patient coming into us where she is presenting with only one problem. It's not uncommon if the lady has osteoporosis, she also has a problem with the hormones, or if she has cancer or arthritis, diabetes, whatever, chronic fatigue, fibromyalgia, the list goes on and on and on. But the point again is that I continue to come back to is you have to identify the cause of the problem. Now, the adrenal glands can be tested, and we do so in our office, but they can be tested by a person by taking the person's blood pressure while they sit down and when they stand up. And if the blood pressure doesn't rise, it could indicate that the individual has weak adrenals. Now, we can also test the adrenal glands by using saliva or looking at the pupils of the eyes. Now, that's going to be up to the physician, the doctor that you go to, how he or she typically tests the adrenal glands, but those are some of the options that you have. Now, the next factor that we have to consider is a lack of vitamins and minerals. Yep, most women. Now, this is going to be shocking, so I hope you're sitting down, because most women have had calcium recommended to protect them from osteoporosis. Now, remember I told you earlier in a previous slide, it could be a lack of the hormones, or it could be the malfunction adrenal glands because they're not producing the right hormones. But it may shock you to know that the recommendation of taking calcium may actually be contributing to your health problems. Absolutely, positively true. Listen, studies show that 9 out of 10 postmenopausal women have osteoporosis to some degree, and over 1 million of those women suffer from bone fractures every year. And now you may say, hey, I'm on Boniva or Fosamax or whatever it might be. Listen, this is a fact. American women already have one of the highest levels of calcium consumption in the world. Of all the women in the world, American women, through the foods that you eat, you're getting more calcium than your counterparts anywhere else in the world. But also, the women in the United States also have one of the highest, if not the highest, rates of osteoporosis in the world. As a matter of fact, women in Asia and India consume a minimal or just a fraction amount of the calcium in their diets than we do here in the United States. Yet these same women rarely get osteoporosis or arthritis. And this is a fact also. Listen, no matter how much calcium you consume, you know, many people think, well, the more I take, the better I'm going to be. The calcium, doesn't matter how much you're taking, it can't be absorbed into your bones without having magnesium present. It can't. So what happens is it will invariably cause problems. It could cause hardening of the arteries. It could cause kidney stones to be formed. It could cause all manner of problems because this calcium now is not being absorbed, and it's basically going in one end and out the other because it can't be absorbed. Fighting osteoporosis and preventing heart disease and arthritis are actually related to the mineral magnesium. In our center, this is one of the main recommendations that we make to all of our female patients. Now, studies show that magnesium is also, you might see yourself here, is also effective in healing migraine headaches, insomnia, depression, PMS, high blood pressure, backaches, constipation, kidney stones. Remember I told you the calcium can't be absorbed, kidney stones, and also chronic fatigue. You see, you've got to have it. Believe it or not, magnesium also helps to fight in the food cravings. Listen, it's no accident that many women get the desire for chocolate before or during their periods. The PMS can be caused, like I said, by low levels of magnesium, and the cocoa in chocolate is one of the world's most magnesium-rich foods. You know, that's why this is the way. Remember I told you earlier on that the symptom is your body's way of telling you that there's something wrong? Well, in this regard, the craving is actually your body's way of trying to satisfy the deficiency in itself. So you grab for the cocoa or the chocolate and you eat that and it makes you feel better, not because you've had chocolate or the sweets, but because you've got the magnesium that was contained in it. Now look, I recommend that, the chocolate bars are great. You want to get the dark chocolate, and you want to really get a bar, and they are labeled now. You want to get like 74% or above cocoa. Then you're going to get a magnesium-rich chocolate bar, and it's not a bad idea to eat one. Eat a little chunk of it every night after dinner or whatever, or certainly during your cycle. And you're going to find, to your surprise, that you're going to feel so much better by having done so. Now, the last factor to consider is nerve interference. And that, if you have nerve interference, it's going to contribute to gland or organ dysfunction, because that's how the body works. There are nerves that cause pain when they're irritated. If you smack your finger with a hammer, those nerves inside that finger are definitely going to let you know. They're going to light up and it's going to cause pain. But there's also other nerves inside the body that control the function of the body. There's nerves that go to the muscles. So when you want to raise your arm, those nerves control that arm, or lift something, or when you eat food, those nerves control the function of the stomach to digest the food, or the kidneys to excrete, or the heart to beat, whatever it might be. But again, they control the function. And when these nerves are irritated or affected, the function to wherever they're going to, whatever organ, cell, or muscle, or whatever they're going to, can be lost. So we as doctors of chiropractic discovered that when we were working to relieve nerve pressure early on in our profession, people were coming because we live in a pain-driven society. If we have neck pain or back pain, well, when these people early, when chiropractic was first forming or being developed as a profession, people were coming in with the back pain because actually it's the most common pain that's experienced by us. And they were often beneficial results that were observed with other problems that the patient had. Now, when the pressure was relieved in the lower back, not only was the pain eliminated or gone, but also other symptoms disappeared as well. Constipation or diarrhea, or the numbness or tingling down the legs, or the weakness in the legs. It went on and on and on and on. There were results of a study in the Journal of Manipulative and Physiological Therapeutics, and they showed that chiropractic care is effective in treating the symptoms associated with PMS, premenstrual syndrome. There were 25 subjects were diagnosed with the PMS, and after completing a questionnaire and going through the whole gamut of things, their daily symptoms were assessed. And out of these, 16 women received the chiropractic adjustments and soft tissue therapy about 2 to 3 times a week before and their menstruation, and during and over 3 cycles of a menstrual periods, over a 3-month period, if you will. And the results showed that there was a significant improvement of the symptoms following the chiropractic adjustments and the therapy. And it was also noted that following this same treatment, the symptoms were improved more so than with the subjects who received no care at all or placebo treatment. And at the end of the treatment program, all of those women in this research had indicated that their PMS symptoms had improved overall while under the chiropractic care, and the research considered the chiropractic care the appropriate method of treatment. Now, there was another research study done, and one of which involved a woman who had been experiencing hot flashes over a 4-year period. she had a significant decrease in hot flashes after she began care, and in conclusion, the patient went from slightly over 4 hot flash periods a day, if you will, to almost 0 after receiving just 11 treatments. So for a 4-year period, she was experiencing this. After 11 times of seeing her doctor of chiropractic, 0. And one woman even wrote in her local newspaper, she stated, and I quote, "I couldn't believe that at 38 I was already going through the changes." And, you know, because of what we mentioned beforehand, it could be because of this. And she stated, anyway, she stated, "I started to get really bad PMS symptoms, migraine headaches, mood swings. Then the hot flashes started. I received a few chiropractic adjustments. It's now been almost 6 months. I haven't had any hot flashes since. Thanks to my chiropractor, I feel normal," end quote. Now, many people are really unaware that as a doctor of chiropractic, they are required to complete an education that's not only very similar, but actually it's even more than the medical doctor graduating from Johns Hopkins Medical School. It's a curriculum that is devoted to scientific subjects such as anatomy, biochemistry, the microbiology, pathology, you know, all the big ology words, the public health diagnosis, clinical disciplines, and health sciences. So it's obvious from what we've covered, from what I've covered and shared with you today, that a holistic or an alternative or a natural approach really should be the first choice. It's essential in treating these problems. And each potential problem area, as I've shown you, has to be evaluated. It has to be identified in order to achieve the maximum health results for the individual. Because really, millions of women are either approaching menopause, or they are in menopause, or are suffering with PMS, and the need to fully understand how to achieve optimal health is essential. It is absolutely necessary. You've got to ask yourself this: are the symptoms, are the problems that you're currently experiencing, are they due to the estrogen dominance? Are they due to too much estrogen, or not enough progesterone, or just enough progesterone but an excessive amount of estrogen? Or are they due to you having low blood sugar? Are they due to the stress on your adrenal glands? Are they due or as a result of a lack of certain vitamins or minerals? Or is it due to some neurological interference in your spine that's causing the dysfunction? Or very likely, and in most cases, are they a combination of several of these? This is what you have to determine before you decide on what path you're going to take to eliminate them. Now, in order for this to happen, the individual has to have a comprehensive and personal treatment program. Each person, each woman has to be individually evaluated to determine the cause of their hormonal problems. It's not just a one-size-fits-all, or it's not a one solution for every problem. It's just not that way. You need to be evaluated by your physician. Now, since you've watched this, I want to offer you this gift. And let me explain what it is. It's the opportunity. You have now an opportunity to receive free of charge, and I mean this, no cost, no obligation, a comprehensive consult and screening so that we can decide what the cause of your problem, of your current situation might be. Now, this consult is going to help us to find what you've done to injure your body. Bodies break down because of injury or abuse, and we can find out from your history why your health has been lost, because it could be something that's happened to you in the past that's now just showing up in the present, and we can plan a way to recover it. This is going to be, I promise you, the most thorough consultation you will have ever received, because we do take your health very seriously. It's going to be followed by a screening to determine if our methods indeed could help you, because frankly, if I find out that your problem is something that we can't help you in, then I am obligated to help you find a doctor that can provide the solution for your situation. Now, some doctors would charge up to $300 and even more for the time that I'm going to spend with you. However, I'm seriously offering you this as a gift, which means there would be no charge, as I said earlier. There would be no obligation. I'm underwriting this for you. And let me tell you why I'm doing it and making it as a gift. It's because I don't want anything to get in your way of finding out if we can help you. Now, my purpose is to help as many people as I possibly can, and I don't want you to have any barrier. Now, you might be saying, well, look, Doc, I saw you on the internet, and I just happened to click this and sit down, and I happen to live in whatever state it might be. Please hear me. I currently have patients that come to us, and not as a matter of boasting, but as a matter of fact, I'm sharing with you that we currently have patients that come to us from over 29 different states and 8 different countries. Why? Because I am intent on finding out what's causing the problem. And if I can find out what's causing the problem, as I said earlier, the solution inevitably or invariably presents itself. Look, we use ways, we look at things in different ways than other doctors do. And if you're from outside the area, we can arrange a Skype interview, because I want to know not just what your problem is, but in this interview, I will be able to determine if I can help you, because I don't want you coming here to us if there's no help that can be offered. We're not here to take advantage of you. We're here to help you in any way we can. And because now of the opportunities we're given through the internet, we can have a long-distance conversation, an interview, and determine if indeed we can help you and what your cause might be. And if we can't, even during this time, we may be able to direct you to a doctor in your area that might be able to help you. So look, you've got everything to gain. You absolutely have nothing to lose. And I want to eliminate as many barriers as I possibly can in helping you to achieve that. So I hope you'll take advantage of this opportunity, this offer that I'm making, and I certainly hope that you found this information that I've shared with you of benefit, and thank you again for taking the time in investing in your health and in allowing me to share this with you. And if we never meet in the future, or if we do, until that time, God bless.